Hi, everybody. Welcome back to In Focus. Now, according to the U.S. Surgeon General's first ever report on oral health in America, there is a silent epidemic of oral health disease in America. The report notes that the Hispanic and African American populations represent the sector with the highest risk of oral disease, with almost 47% of low-income Hispanics and African Americans have an untreated tooth decay.
Yeah, as a matter of fact, Brian, the report also added that inadequate education and limited access to dental professionals contribute to untreated tooth decay in over 1/3 of all children of low-income families, resulting in more than 1/2 of all the children between the ages of 2 and 8 having dental decay. So joining us on the show today to tell us about the children's oral health care is Daniel Martinez, Managing Dentist of Western Dental Services in Burbank. Welcome to the show. So good to have you here.
Good to be here.
So it's the ages of 2 and 8, right?
Well, it's actually 6 and 8.
6 and 8. Okay, there you go. And this is the oral month for kids, right?
That's right. February is the National Dental Health Month, basically.
But of course, you know, we should take care of our teeth all year round.
All year round.
And, you know, and that's the thing too. It's like, especially with kids, it's so tough. You know, you want to look at cavities and things like that. We look at our little guy right here. He's got such perfect teeth, and he's my new interview partner here as well too.
Thank you.
To go along with you. But now, one of the things that's so critical right now is preventative. I mean, not only do you have to have good teeth, but the preventative
gums.
With your gums.
Tell us a little bit.
Well, let me just start off by saying that I'm excited to be here. Any opportunity we have to educate the public is a positive. But as you were pointing out to Jerry the giraffe there, he has some perfect teeth, and all kids can have teeth like that if they take care of their teeth, basically. As far as preventative, there's all sorts of things we can do. Everything from sealants to brushing your teeth to flossing are all good ways to prevent cavities.
Well, we have a couple of guidelines that maybe not only kids but our parents should also hear about. We have the basic guidelines for good oral dental health are regular brushing and flossing, regular visits to dentists, and of course we just heard that Hispanic and African Americans of low-income families are the highest at risk to have bad teeth.
Well, here at, actually we've noticed at Western Dental where I work at that we have a higher incidence of decay in children's teeth. A lot of that just has to do with more education than anything. In this area, a lot of parents think that it's just baby teeth. They don't see the importance of taking care of those teeth because underneath those teeth are the permanent teeth. And the habits that they have now are going to carry through when they're older.
Now, touching on that a little bit there, talking about the community, is it more like a parental type of thing that they don't educate the kids themselves?
Yeah.
And then how do you overcome that?
Well, education is the key. A lot of times these parents don't get involved, and they need to get involved in brushing teeth. If you have to make it a group thing, you all go to the bathroom, brush together, make it a family thing, make it a habit. The point is, make it a habit. That's very important.
You know, it's funny, Claudia, we talk about parents getting involved with all types of things, and then, you know, you really have to get involved with health issues too, such as just brushing your teeth.
That's right.
So let's start with the basics. What exactly causes tooth decay? What is tooth decay?
Tooth decay is bacteria. Bacteria release acids that eat into the tooth. So what you can have here is, on this tooth here, this is a healthy tooth. On the outside of the tooth is enamel, which is the protective layer. On the inside, this more tannish color in here is the dentin. Inside of here is actually the nerve, or the pulp.
The pulp.
The pulp is very sensitive.
Sensitive, yeah. You don't want to go down near that.
That's right. And actually, if you get a cavity, if it gets anywhere near that pulp, it can kill the pulp. But cavities can cause decay. So if you look at here, you have a cavity coming through the top. Looks nice and brown, and that's the way it looks when we drill it out. And if it hits the tooth, you can actually get an infection of the pulp, and then you need the dreaded root canal.
Yeah, but you know what? That's not really going to happen until much later for people that are maybe middle-aged or somewhat, or young, maybe 20s or something like that.
Believe it or not, there's children that will need what we call a pulpotomy, and a pulpotomy is what we call a baby root canal, and that's where we remove the top portion of the nerve, put some medication in there, and then cap it with a silver cap. So have you ever seen any children with silver caps?
Yes.
They probably had a pulpotomy done. That means that the cavities entered too deep.
Wow, and that's even, is that after like they've had their baby teeth drop out and they go to their primary teeth?
Well, their primary teeth are the first sets of teeth they get in there, and they don't get root canals on primary teeth, they get pulpotomies.
Okay.
Once they lose those teeth, which start leaving anywhere from the age 5 to 7, you start getting into the root canal word, and that's something that a lot of kids, we've had children as early as 8 years old needing to have root canals done on their permanent molars in the back, and that can be pretty traumatic.
It's traumatic, and you know, also, it's painful. I mean, it's really painful for the child to be sitting there and to go through that type of thing.
That's right, and they don't understand what's happening, and I think that's their biggest concern is children don't know what's happening. They see a dentist there in a white coat, and they don't understand that we're trying to help them.
So why don't we talk a little bit about dental care for the different ages? Because, you know, of course, an adult has already hopefully gotten into the habit, but how do we take care of children's teeth?
Well, the American Dental Association says that as children are smaller and they're not able to spit out the fluoride, to give them a pea-sized amount of fluoride on the toothbrush. So you put just a little bit of a pea size on the toothbrush and brush the teeth for them. That's the best way to go. I personally, with my child, we went ahead and we put non-fluoride toothpaste in the beginning, and there's a little finger toothbrush, and we brushed her teeth when she was about 8 months old we started, and now she opens her mouth willingly. It's just a habit. As they start getting older and they're able to spit, then you can start going more into the fluorides. As they swallow fluorides, it can be a little bit upsetting to their stomach. That's why I don't recommend giving anything with fluoride when the child is just going to swallow it.
Now, healthy diet is also very, very important for maintaining good oral health, right?
Oh, it's extremely important. A good, healthy diet means good, healthy teeth. As you start getting more into the sugars, the processed sugars from candy bars and such, you start getting more higher incidences of cavities.
Of course, and because they don't brush immediately.
Right.
And so we have that problem. So now we talked a little bit about taking care of teeth. What about the gums?
Well, the gums are important too. What we can do is actually we can show you kind of how to brush.
Exactly.
That might be a good idea, and we can show you that with Jerry the giraffe over there.
Okay.
Let's bring old Jerry in here, my interview partner.
There we go. It's your favorite over there. Well, basically what you're going to do with Jerry is you're going to get the teeth and you're going to make sure that you get all sides of the teeth. You're going to go to the fronts of the teeth, you're going to go to the tops of the teeth, and you're going to go to the insides of the teeth. That's very important. Kids need to know that there's more than one side of a tooth. They just can't go up on the tops. They have to go to the sides and on the inside, okay?
Now, when you're brushing, Doc, you don't want to do that sawing routine,
no, not all the
you?
time. You want to go up and down. We call it a
massaging
technical term is a modified bass, but
yeah.
you're going to go ahead and start aim towards the gums and go outwards. Towards the top, you're going to go towards the gum at a 45-degree angle and go down. And you're going to want to do that for all surfaces of the teeth, such as Pearly White over there. Pearly White has more than one side to his mouth, and you want to go all the way around, Pearly White there too. So in other words, brushing all the way around and flossing.
Oh, flossing is the key word. How do we get kids to floss, though?
Well, a lot of kids don't have the manual dexterity.
Floss?
That's a good question. Manual dexterity is important with flossing. You've got to be able to wrap that floss around your fingers and place it between your teeth. And a lot of young kids don't have that ability until they're a little older. So what you want to do is floss for them. Novel idea, but it works. You can actually put the floss around your fingers and go around the teeth, and that prevents the cavities from happening between the teeth, such as in this picture here. You have a cavity coming in through the side, and flossing will take care of that cavity on the side. And we see a lot of that at Western Dental.
Yeah, now what about automatic flossers? Do they do the job?
Well, automatic flossers are pretty good.
You're not going to give yourself some gingivectomy or something
well,
like that?
Well, that's the problem. For kids, you want to stay away from any kind of electric toothbrush or anything like that, because they're going to think it's a toy and they can actually harm their teeth more than taking care of them.
Yeah, you can burn the teeth.
Oh, big time.
And another thing, what kind of toothbrush is necessary?
Good question. Soft toothbrush always. A lot of people think the harder the better. It doesn't work. You're going to end up lumberjacking your teeth in half, and that means you're going to actually, you can saw your teeth in half if you go side to side with a hard toothbrush. And we've seen that a lot.
Now, when you go to the store, like a drugstore, to buy a toothbrush or something like that, does it say soft, or does it say extra soft or hard or something like that?
Yeah, there's normally 3 types: of soft, medium, and hard. And I'll be honest with you, soft is pretty much the only way to go. Even if you don't feel like it's doing much, it's doing enough, trust me.
That's all you need. And also sizes, right? Because depending on how big your mouth is and the cavity, actually, you don't want a big ol' honking tooth. I mean, a big ol' honking toothbrush.
That's right.
Like that.
For kids, you're going to want to go for something a little smaller. Now, for the bigger mouth person, this might work.
That's
but
for
normally,
Mr. Ed.
There you go. But normally, a small toothbrush for a child, and then a regular type for the adults.
Okay.
Now, sealants. You're talking about that a little bit. Is that really helpful for young children?
Oh, sealants are excellent. What a sealant is, it's a plastic coating that goes around the tooth, up on the tops of the teeth. There's no drilling involved. There's no anesthetic involved. It's a really painless procedure, and it protects the tooth. It's more like a helmet for the tooth. It protects it.
You know, you see all these different types of toothbrushes or toothpaste that are out there. Like now, you got your whiteners, you got your preventative care, and all this type of stuff. Peroxide. What's good and what's healthy for young kids?
Well, I'm a little old-fashioned. I just say the regular type of toothpaste is about the best, in my opinion. You have tartar control and such, but it's tartar control because it has a little bit of abrasives to it. I personally stay away from that myself.
The abrasives are good for?
Well, for removing the plaque, but if you floss and go to the dentist every 6 months,
and
you really
don't
shouldn't
smoke
need
and
it.
drink coffee in large amounts.
That's right. So, in my opinion, and strictly my opinion, regular toothpaste would just be fine. I don't think you need to get too technical.
And you know, the
about
thing is, on those commercials, you don't need to rope it on there like that. You can just have a little dab, and that'll do you. And that's really all you need.
That's all you need, trust me.
Yeah.
And real quick, before we go to a
Saves
break,
on cost,
fluoride.
Mom.
We talked about it real quick. We just mentioned how much we needed. But what exactly does fluoride do?
Well, fluoride hardens the teeth. It sort of works by replacing a certain molecule in your tooth and makes the tooth harder. In the city of Los Angeles, though, they don't recommend us supplementing fluoride because we have plenty of fluoride in our drinking water.
Is that everywhere in Los Angeles?
For Los Angeles County, everywhere. We actually got a memo about that by the state of California telling us not to supplement. So actually, if you drink water, you can have plenty of fluoride.
There you go. That's why we hope we have big, strong teeth.
That's right, and we're going to keep them too.
That's
floss, brush, brush. Right now, when we return, we're going to continue our conversation with Dr. Daniel Martinez, managing dentist with Western Dental Services in Burbank, and he's going to be joined by Mr. Gordon Walker, Vice President of Sales and Marketing for Western Dental. We're going to be right back. Welcome back to In Focus. Now we're talking about good oral dental care right now for children with Dr. Daniel Martinez, and also joining us right now in this segment is Mr. Gordon Walker, Vice President of Sales and Marketing for Western Dental, and welcome to the show. Now,
thank you.
You know, we were talking a lot about some alarming statistics there earlier in the show for young kids. And one of your main jobs right now is to really help educate everybody out there. And tell us about your job as educating everybody.
Well, a big focus for Western Dental is education in the community. I mean, we're talking, you know, the state of California, which is our primary emphasis, and you mentioned the alarming statistics. Well, the alarming statistics are even worse in the state of California. The incidence of cavity-free children is much less. I mean, it basically
almost non-existent.
Correct. Well, I think it's 27% of kids between the age of 6 and 8 are cavity-free.
That's really, really sad.
That's alarming.
Yes. Yeah. Now, tell us a little bit about the Healthy Smiles 2010 program. Is it 2010 or 2010?
Well, 2010.
Okay.
Sounds like Vision. 2010.
That's a program that Procter & Gamble and Crest have developed, and Western Dental is one of the groups involved in helping move this message of dental education out into the community. They're working with colleges, schools, you know, a number of different outlets.
Well, that's great. There you go. That's the Western Dental logo.
Here's got some video right there you're taking a look at of all these kids. Now, Gordon, help me out here. With all these kids, are going through the screening process?
We announced the partnership on November 1st, and we had a large press conference. We screened about 300 kids that day. And we go into schools around the state, screening children for cavities and distributing educational material. Material they can bring home to their parents.
I'm interested to know, Claudia, what did you find in those screenings?
Well, Dr. Martinez was involved. I think, what would you say, statistically?
Well, there's a lot of cavities, basically.
A lot of cavities,
and the worst part of it all,
neglect.
That's right, they were untreated, which makes it even worse. You know?
Yeah, and I think this is a great thing for children to bring it back to their parents. That way, we involve the parents in the education part of it.
Well, you know, one of the things that Western Dental does is we'll go into schools, we'll do general assemblies. You saw a picture of Pearly White earlier. Well, Pearly White kids are enamored by Pearly White. Pearly White's a celebrity.
Appeals to them in a way.
Correct. So we'll do a general assembly. Dr. Martinez, someone like him, depending on the part of the state, will present a program on dental education, just the basic fundamentals. And then we'll follow it up with take-home information, giving the kids a good toothbrush.
Exactly.
Giving them toothpaste.
An example they could follow, basically.
Right, and the folks at Crest have been very helpful in this.
Crest's been a household name forever, yeah.
Yes, they
Forever,
have.
yeah.
And as a matter of fact, at a recent event sponsored by Western Dental and Crest, here's what Board of Education member Victoria Castro had to say about good dental care.
We forget that sometimes there are kids that don't have access to dental service. You know, we've been working and publicizing the need for early healthy kids and the Healthy Start and all the programs, but we forget the role of dental care. And I think that your smile, your teeth are all so much a part of you. And today, as I walked around and talked to kids, that's what it's about. They need to be instructed. They need to know that there is a need just to go to the doctor when you're ill, that if something's wrong with your tooth, you've got to say, Mommy, Mommy, do this. And we also want to continue our relationship with all the sponsors that have approached the district. Dental care is just as important as any other care. You can't read, you can't ride when you have a toothache, and we deeply appreciate the sponsors here today. And the kids are having a great time. Parents are not as informed as you've noted, and that we have to continually outreach to them. But the gift given here today is once a child is screened and something is identified in need, the school will follow up and will get that dental care and work with the parent and talk about the importance. But nothing is as important as a child knowing for themselves how important it is to maintain their teeth, because they'll go home and say how important maintaining, and this is probably our best notification to parents, when kids know what should be in their life and on a regular basis.
There you go.
Yeah, and you're going to have, if you have better oral health, you have better grades out there too, I bet.
And not only that, you could tell us a little bit more about this, but about gum death and the correlation with high blood pressure and diabetes.
Well, what you want to think about is that the mouth is sort of a window to your health. Almost every condition that you have in your body can be diagnosed through your mouth. So the regular checkups is going to help you to be able to find out whether you have a certain condition, such as we always do oral cancer checks and such when you come in, and sometimes that's the only time you'll ever realize you have a problem.
Wow.
Yeah, you know, and also kids also get their checks too early on for braces if they have an alignment problems.
Yeah,
and, you know, you were talking about being metal mouth right there.
I was a metal mouth. This is exactly what I looked like.
It's kind of traumatic for kids, but it's something that's definitely needed because you have to keep your teeth in line.
Because look, this is how they
and
look
now
now.
you got perfect teeth like her.
Hey, but tell us a little bit about braces and what kind of orthodontic care are we looking forward to, especially nowadays?
Well, I tell you, some patients can come in with dentitions that might be a little bit off, such as this. Oof. And you can end up, if you put braces on, you can end up with nice straight teeth. So basically, braces come in different types. You have the regular metal type, if you remember those back in the days.
Yes.
You also have some porcelain types that are more clear. Make it a little bit easier for you to
Those are more expensive though, right? But they are covered by insurance?
They are not that expensive, believe it or not. Here it is with different colors. If you look very closely, there's different colors that you can actually make the braces if you like to be a little bit more flamboyant on your looks.
But this is the coolest thing.
Yeah, this is Invisalign. Now, the thing is that Invisalign can't always be used for everything. Invisalign is very specific for particular types of movements, since it really is more, how can you say, you really need to be on top of things because you need to have that habit of putting it in your mouth. The other ways...
So you can take this out all the time.
Right, which is not always a good idea.
It's like a typical retainer.
Now, how many people keep the retainer in all the time?
No,
It'll take longer.
That's the point. Now, if you have these regular types, you don't have any choice. Your teeth are going to move. This way also a little bit expensive, almost double the amount.
And again, what about insurance?
I don't really have that information on the insurance part, but you can bet that this is going to be much more expensive.
Right.
Wow.
Yeah.
So, and I also understand, just changing gears real quick, that teachers and students can now receive a free oral health kit through the Crest first grade dental health education program. And are you guys participating in that?
Yes. Every year during Children's National Dental Health Month, Crest makes available to teachers across the country. I mean, it's phenomenal the amount of education that's distributed. Dental health education kits.
Okay.
Their guides, here's one of that.
And they can also call this number, 1-800-543-5201, right?
Right, and they can order their kits for next year and
there
be
you
prepared.
Go. There you go. So if you're ahead of time, just make a phone call and get the kids as many as they need or as many as they want, or...
And they work very closely with the schools.
Yeah, and Western Dental seems to be doing a lot with the schools too right now. By the way, how many centers do you operate across California?
We have over 140 up and down the state, and we're growing.
And you also have specific offices for orthodontics as well.
A number of our offices will be general dentistry and orthodontic as well. But about 100 are general dentistry and about 40 are orthodontic.
All your oral needs.
Yeah.
Right? Oral health, I should say.
Oral health, floss, brush your teeth and floss. Yeah. For more information about Western Dental Services, please call 800-6-DENTAL. Now, what's that number?
Yes.
Oh, well. Or you can visit the website right there, westerndental.com.
Exactly. Also, thank you very much for joining us today on In Focus. Please tune in tomorrow when our guest will be Joanny Roan, Educational Service Managers for the Daily News of Los Angeles, and Miriam Janol, Director of Education for Portal Center for the Arts. And they'll be here to tell us a little bit about the Daily News in Education program and the Youth Playwrights Festival. See you all tomorrow.
Bye-bye, everybody.